Well, welcome everybody. You will now have learned that New Zealand has become the 48th country to identify a case of COVID-19. Earlier today, the General indicated we had a suspected case. We can now confirm that case has been confirmed. Originally, it was thought that the person was a permanent resident of New Zealand. I can now let you know that that person is indeed a citizen of New Zealand and has a New Zealand passport. The person, I'm assured, is in a condition that is improving. So that will be comforting news to wider circle of friends and family. I'm confident that the risk of this disease is being very well managed. The person with the COVID-19 condition is being treated in Auckland City Hospital, and with their improving condition and isolation shows that it's being managed well along the way. The negative pressure room has been used. All of the protocols have been followed that have been put in place. And of course, as a safety measure, those close contacts are being looked to now, but the Director General will say more on that shortly. What I can tell you, though, is that the person, upon arrival, travelled home in a private car, and when they became concerned, they contacted Healthline. They followed all of the steps you would hope would be followed, so that when they were then referred to the emergency department, everybody knew that they should take the appropriate precautions. This person also tested negative to COVID-19 on 2 occasions, but obviously clinical judgment was to continue and look in greater detail. The assessment of health professionals, the scientists, are that sporadic cases may continue to arrive in New Zealand. We have been managing the situation well, in my view, and have been also fortunate that we haven't had cases arrive here, where we know there's been north of 20 cases in Australia. And as I say, we are the 48th country to receive a case in New Zealand. Anyone who is concerned, of course, should contact the dedicated Healthline, the COVID-19 number 0800 358 5453. It's free and available 24 hours a day and has appropriate language resources there. My main message for now is please, out in the community, help us to help you. If you are concerned, ring that Healthline number. It is likely that from time to time we may get further cases, but there's very unlikely that we'll get a sustained community outbreak if people take the necessary precautions, good hand washing hygiene, making sure cough etiquette is followed, and contacting Healthline if there are any concerns for further advice. Those are the things we would do in any case of an infectious disease, and they are the right things to do. So please, out there, if anyone has any concerns, take those necessary steps. We are well prepared because we've had time to be prepared, and those border restrictions we put in place have meant that we haven't had a case up until now. That's brought us time. It's meant that we have a better understanding of the virus than we had at the beginning. We understand better how it spreads. We know who it affects the most and how it can be best contained. The border restrictions, therefore, have served to minimise the chances of cases arriving by restricting access to New Zealand for foreign nationals. We've got the plans in place, we've got the testing regime in place, and we've got the understanding of the virus and how it spreads. And now we move into the next phase of our plan, and we make sure that we contain the isolated case that has arrived. So I'll hand over to the Director General to make more detailed comments, and then we'll be open to questions. Thank you.
Kia ora koutou. So as you all know, late this afternoon around 4:15, we were formally informed about this COVID-19 test result from a person in their 60s recently returned from Iran. This is our first confirmed case. We have been preparing for this for some weeks, and we are ready. The preparations have paid off. We are very confident that the public risk from this new infection is being well managed because of public messaging, the wide awareness of COVID-19, and our public health response that we know is robust to managing cases and their contacts. Now, although we do have a case, as the Minister mentioned, our assessment is the chance of a community outbreak remains low at this point. Public health officials have begun tracing the patient's other close contacts to ensure that appropriate protection measures are in place, and this includes a group of people who were on the flight involved, particularly for the final leg, which came from Bali to New Zealand. The people who the Public Health Service in Auckland will be contacting will be the people who were in the same row as this individual or the 2 rows ahead and behind. Those people will be contacted by Public Health. They will be required to self-isolate for 14 days, and that self-isolation will be under the regular communication with the local public health units. As the Minister mentioned, we know this person arrived here on the 26th of February. They travelled by private vehicle to their own home with family members only, and not much later on that same day, when family members were concerned with that person's health, they contacted Healthline. Healthline rang ahead to Auckland City Hospital, and all the right protocols were followed. The Minister has mentioned that 2 earlier tests for COVID-19 were negative, and I just want to reinforce the expertise of the clinical staff who had a high degree of suspicion. This was the first case that has been tested where the person fulfilled the definition of a suspected case, so they did take further samples, and that subsequently proved positive. Hospital staff involved in the patient's care throughout have used appropriate personal protection, and as you know, our DHBs have been preparing for this situation and have dealt with it appropriately. The overall situation internationally, as you know, remains rapidly evolving, high uncertainty, and we continue to take a precautionary approach. I just want to emphasise that the process that's been followed here by this Kiwi family and the health system has been exemplary, and it reinforces the importance of everybody doing their bit. We have been asking New Zealanders returning from China for the last, since the 3rd of February, to self-isolate for 14 days and to register with Healthline. We are now asking New Zealanders who have returned from Iran in the last 14 days to self-isolate and to register with Healthline. So anyone in New Zealand who has travelled through or been in Iran in the last 14 days is now being requested to self-isolate and to register with Healthline. We do know there is a much smaller number of people who come in from Iran than they do from China, so this will be a much smaller number of people. But I do want to reiterate that we are now requesting and expecting those people to self-isolate for a period of 14 days or the balance of the 14-day period since they were in Iran. The other thing I'd like to emphasise here is that anyone who has symptoms and has been in a country that has got COVID-19 and or has been in contact with a confirmed case should not turn up at their local GP. They should ring Healthline ahead, or if they're going to visit their GP, they should ring ahead so that the GP surgery can take the right precautions. So in summary, what has unfolded in this case is the reinforcement of the importance of basic precautions, the importance of everybody playing their part, the importance of not alienating groups or communities. People need to feel empowered and enabled to do the right thing. In this case, we have a family that did exactly the right thing. We are working hard to protect New Zealanders, and with your help, we will be able to achieve that. Thank you very much, and we're open to questions.
Dr. Blucher, can you explain exactly why this person failed? The first two tests came back negative, yet the third one came back positive. Did something go wrong, or what happened there?
It was the nature of the sample that was taken for the third test. The first 2 samples, which were taken from more on the throat or the nasopharynx, were negative, but the patient's symptoms were much more suggestive of a lung infection, and so a sample was taken that then did test positive.
You're regretting not putting travel restrictions in place for Iran and Korea?
The situation in Iran has evolved very rapidly, and in fact, earlier in the week we were concerned. We initiated the work to look at whether we should add Iran to the list of now called Category 1 countries, so alongside China, and that decision has been taken, and that restriction came into practice at 6 o'clock this evening.
You don't think it should have been earlier?
I think we reacted very quickly. The key thing about Iran is the information evolved very rapidly, and we're not certain that all the information that we are getting is fully describing the situation there in Iran. Remember, it has evolved quite rapidly, and we have responded rapidly.
How many family members are in isolation at the moment?
I think it is 3, but we can confirm that.
Could this have been prevented if you enforced travel bans to Iran?
This person had actually travelled to Iran some weeks ago to visit family, and they have now returned back to their home country, or the country where they're now a citizen, New Zealand. And so no, Iran, remember, the situation there has only become apparent really in the last week.
What was the man's symptoms?
Sorry.
What was the man's symptoms?
I haven't said it was a man. This is a person. I'll continue to use that. So the person had symptoms of cough and difficulty breathing. So very much lower respiratory tract symptoms.
Was the third sample tested in any different circumstances to the first 2, sort of location-wise, or different lab, or different?
No, the same laboratory.
Will you be retesting everyone else that was a suspected case that came back negative to this point?
No, we won't be doing retests on the negative test, because this was actually the first case that fully fitted the suspected case definition. I've talked before about us having a low bar for testing where there may have been a possibility, and we wanted to rule out COVID-19. Those tests are negative. I think this case reinforced both the value of applying clinical judgment to the symptoms a patient has, and then the fact that our testing is good.
Will this change anything for going forward?
Sorry.
Will this change anything for going forward with testing?
It won't change anything. What I can say, though, just in terms of further testing, we are going to be offering testing to the family members of this person who are in isolation.
Why was this case not picked up at the airport?
So, yes, my understanding is the person was unwell. The person travelled in on a New Zealand passport, and so they may have been seen by a customs officer, or they may have gone through an e-gate.
Right, so he was unwell, but no one picked up that he might have coronavirus.
So the flights from China, which has been our Category 1 country, or the country where we had been meeting everyone off the flights, if someone was unwell, they would have seen a nurse. This person travelled in from a flight that came via Bali. So what we are doing now, and we talked about this earlier this afternoon, is ensuring that people, from now, we will be scaling up our presence at the airport, and everybody coming in internationally will receive information about what to do if they are unwell and or become unwell. And if they are unwell, we will have available health staff to check them.
Where is that Emirates plane now?
I'm sorry?
Where is that Emirates plane now?
Oh, I have no idea.
Has it been just decontaminated, or?
Look, I don't know, but planes are cleaned with normal, very good cleaning procedures anyway, but that's something that will be followed up with the airline.
So the person went to hospital on Wednesday, but when were they put into the low pressure isolation room? What's the timeline for that?
Yes, because there was a high suspicion because of the symptoms and where this person had come from, full infection control protocols were followed throughout, and the person has been in a negative pressure ventilation room since they were admitted.
Can you explain what that is?
A negative pressure ventilation room means that essentially because there's a negative pressure in the room, it means air, whenever the door is opened, air can come in, but it can't get out. So that reduces or almost eliminates the likelihood of a virus or other infective agent being able to exit the room.
The people that were on the plane that you were concerned about in the rows nearby, have they gone on to other centres? Do you know where they are?
That's the process that's now underway. So the Auckland team has been planning to do the contact tracing since this morning, because this was a suspected case, and they've now initiated that process. These people could be around New Zealand, and they'll be following the right protocols to trace them and then to advise them what to do.
But there's a likelihood that these people have gone on from the airport either to other international centres or about their lives in New Zealand and potentially are carrying coronavirus or COVID-19.
It's possible, and yes, that's why we trace them wherever they go. And you will recall that early when Australia, when Australia identified its first case, we had some Chinese tourists here in Rotorua who had been on the plane, and they were traced and assessed, and that's the normal process. So the tracing crosses international boundaries as
How
well.
quickly can that happen?
Very quickly.
Will you be releasing the seat aisle numbers?
We don't plan to do that. That will be something that the public health unit will
And
do.
in your perspective, from your estimates, how likely is it that this person already has obviously transmitted this virus to anyone else?
No, we have no evidence the person has transmitted the virus to anyone else. I do understand that the person was wearing a mask throughout the journey of the flights, so that will have reduced the likelihood of droplet spread from cough or sneeze. So that's encouraging.
Is it gauged as likely?
No, but no, let me say, it wouldn't matter whether it was likely or unlikely. We would do the same contact tracing.
Dr. Bloomfield, can I just ask, what's the rationale behind the is it 2 rows forward, 2 rows behind the person in the same row? Or is there, what's the rationale behind that decision? Why not the whole plane?
That's a standard protocol we do, because recalling that infections like this are spread by droplet spread, so that's sneeze or cough, and it's been a protocol we've used for some time. Other countries use it as well. It's the one we used during the pandemic flu here in 2009 as well.
So how can you be sure that other people on the plane weren't infected? Maybe people that have been to the bathroom after that person or something like that. How do you know that they weren't infected?
So close contact is someone who has been within a metre of the person for more than 15 minutes. So we will also be contact tracing the crew. That is the not the pilots, but the people, the stewards who were in the cabin. They will also be part of the contact tracing. So again, that definition of close contact is someone who has been within a metre for more than 15 minutes.
Feel sure that no one else on the plane could pick it up.
This is based on the evidence that's been accumulated over many years, that actually the appropriate group to do contact tracing on in an aircraft is those who are in 2 rows ahead, the same row, and 2 rows
What's
behind.
your advice to people traveling to New Zealand? From this sort of scenario, it seems that anyone could be sitting next to someone with coronavirus.
Yes, that's possible, and it emphasises the importance of people taking basic precautions, whatever setting they are in.
This person went home in a private car. How were they only at home before then going to the hospital?
Not very long, actually. The family became concerned about the person's condition and rang Healthline. Again, that was exactly the right thing to do, and in discussion with Healthline, then arranged for that person to be assessed at Auckland City Hospital.
We'll take 2 more folks. 2 more
Yeah.
questions.
So,
Got over
yeah.
a little bit of throat issues, but just so people might.
So the key symptoms of COVID-19, again, these are not specific to COVID-19, are fever, cough, and difficulty breathing. People may have other symptoms, but those are by far the major symptoms.
Just to be really clear, the decision earlier today to put a travel ban in for Iran, was that triggered by the suspected case, or you were already concerned prior to, this person fitting the definition of a suspected
Yep.
case?
We were already concerned earlier in the week because of the rapidly evolving situation in Iran, the increasing number of deaths and cases, and it was clear that there were outbreaks widespread across the country. So we moved quite quickly then to provide advice to ministers recommending that Iran be treated in the same way as China.
And it takes a couple of days to do that.
Well, we had to assess the evolving evidence, and then we put the advice up quickly, and ministers made a rapid decision.
Can you tell me exactly how you will be stepping up procedures now when people come into the country?
So the main thing here is, and as I talked about earlier on, we have an increasing number of countries with cases. We have an increasing number of countries with outbreaks in the community. The important thing here, as we have done right from the start here, is to ensure that any person coming in receives information about what to do if they become unwell.
So you'll be testing them.
We will not be testing people as they come in. Yeah.
Okay, folks, can we make this one the last one, please?
Thomas, given this is sort of, escalated somewhat, what cross-agency or cross-governmental actions are being taken? Will there be further ODS meetings, cabinet?
Well, those are ongoing things, and they're meeting in an ad hoc way. I mean, actually, probably Dr. Bloomfield's the best person to describe the nuts and bolts of that, but there is a cross-government group. You'll be aware there's an advisory group which recently changed the case definition to include a broader range of countries as an indicator. These kind of technical groups are continuing to meet, and the cross-government response groups are continuing to meet.
So that's what we have throughout the weekend and tonight.
Dr. Bloomfield will talk about the next steps.
I think we just also need clarification on whether we would have had these travel restrictions in place this afternoon if the suspected case hadn't come through.
The answer is yes. That was a separate process. And I can also just reiterate that we actually had no desk meeting this afternoon. There is a series of meetings again next week, and these are not the first. So we have a range of cross-government groups that are working together, and our work is guided by our pandemic plan, which is a very clear, well-described and detailed framework for the sorts of actions that need to happen, not just across government, but right across society. Okay, thank you very much. Really appreciate you coming.